Warning tonight from state police. A more lethal strand of heroin, stronger than before, is apparently being distributed right now in our region. Police believe that that's the reason they're seeing a spike in overdoses. 94 of them total region-wide, 6 deaths in just 12 days. Those stats are from the end of January and then into February. And during that time frame, emergency workers or others administered Narcan at least 57 times. That's, of course, the nose spray that can help reverse the effects of an opioid overdose. 3 of the deaths that we mentioned and 20 of the overdoses were in the southern tier. In those rural areas, it can take medical crews longer to get to the scene, and state police say that can contribute to an overdose turning into a death. Joining us live right now to talk about this is Steve Kilburn. He is the Grant Projects Director at the Chautauqua County Department of Mental Health. Sir, we really appreciate you taking some time to talk to us about this. And thankfully, as we look through the numbers, none of these overdose deaths was in Chautauqua County. But I wonder what you make of the fact that this was happening in counties that are adjacent to yours, and just any time we hear of these trends, even if it's not impacting you directly, how you kind of process that and move forward with it.
Yes, well, sadly, these sort of spikes are not unknown to us, even though at the moment it does seem like it may be affecting our neighbor counties more than us. But, we're always concerned about the numbers of overdoses happening, and they're always too high. Unfortunately, what's become kind of the norm would have not, but a couple of years ago, been considered an extremely high number of overdoses. So while we're not seeing a spike in our county at the moment, we are seeing a kind of chronically high level of overdoses and sadly overdose deaths.
Yeah, and Steve, one of the alerts that came from state police as part of this, kind of news release put out to the public, really talked about how it's different in terms of the response when you look at rural areas versus urban areas. And there are plenty of rural parts of Chautauqua County. How does that impact how quickly emergency crews are able to administer Narcan or even get to someone who may be experiencing an overdose? And how does that kind of add to the challenges there in Chautauqua County?
Yeah, sure. Like any rural county, unquestionably, response time to any medical emergency, which an overdose, of course, is critical. Minutes mean the difference between life and death. It's one of the reasons why we really emphasize, and we believe actually with some success, have seen the distribution of Narcan into the hands of really anyone, especially anyone who may likely encounter somebody who has an opioid overdose. And in point of fact, here in Chautauqua County, we know that there are probably hundreds of overdoses that are reversed, lives saved, because folks have Narcan and use it even as they await the EMS response.
Yeah, we know how life-saving that has been over the years. You mentioned to us before earlier today when we talked to you that while maybe you aren't seeing this increase in heroin use, heroin overdoses, and heroin deaths, fentanyl remains a huge concern there in Chautauqua County. What is the latest on that in terms of what you're seeing?
Yeah, absolutely. The spike, if we want to call it that, is something that took place here, as it did across the state and really across the nation, beginning in 2021, when the numbers of overdose fatalities reached really unprecedented levels. And while we don't have all our numbers for 2022, sadly, we think it's going to be quite similar to the previous year. And if there's one contributing element to the fatality rates, it is the supply of illicit drugs, and specifically the presence of fentanyl. Fentanyl has initially come kind of laced into heroin. Fentanyl is itself an opioid, although far more potent even than heroin. But since the sort of initial introduction of fentanyl into the illicit drug supply, what's taken place is, well, a couple of things. One is it's come to be found in drugs of all sorts. So amphetamines, methamphetamine, cocaine, sometimes with folks not even intending to take an opioid, are being exposed to it, and of course, with sometimes deadly consequences. The other thing that's happening, certainly here, and I don't want to speak for other communities, but here in Chautauqua County, heroin is frankly largely gone. The drugs are perhaps sold on the street as heroin, but at least in terms of those folks who sadly do die of a drug overdose, heroin is not showing up in their toxicology reports. It's fentanyl.
Yeah.
If there's one reason for these overdoses and deaths, it's fentanyl.
Steve, I'm out of time, but if you can take 10 seconds here before we go, you want people to leave this conversation with some hope. Lots of services available there and region-wide.
There absolutely are. Even when we hear these, and of course we can't talk about addiction and overdoses without it being sad and sometimes tragic news. But we must also add that there is hope. There are folks who do get in treatment and successfully, and we encourage people to reach out to the many resources that every community and every county is offering.
Steve Kilburn is Grant Projects Director at the Chautauqua County Department of Mental Hygiene. Thanks for helping us better understand this headline. We appreciate it.
Yeah, thank you.